And one of the most important practical aspect of this is when you get a patient of post-meniscal surgery, what is the most concerning thing for you? If you get a patient who had a repair, of who had a bucket handle tear, got repaired and came to you, which movement is most dangerous for that patient, or which is very harmful for the patient? Which movement can injure the bucket handle tear? See, if a person goes to meniscal surgery, what the surgeon do? They are suturing the meniscus back to its normal position. They are not placing something new like an ACL surgery or PCL surgery. They are keeping a brand new graft. They are keeping a hamstring graft or patellar graft. So they are providing a brand new structure to there. But in case of meniscal repair, they are only suturing the damaged structure, and they wanted that structure to heal by its own because there's a good if it is a good vascular supply, they wanted it to heal. In that case, what is the major concern of a physio? Which movement you should not do in the initial rehabilitation phase of a post-meniscal surgery? Hope I am audible. Hope my question is very clear. If you get a patient with post-meniscal surgery, which movement you should not do in the initial phases? Okay, getting answers, rotations to be avoided. No other answers. We cannot do flexion, flexion. Flexion, walking. Flexion. Okay. No weight bearing. Okay. These two answers are actually right, but I will tell you how it got right. So flexion beyond 30 degrees, some wrote flexion. See, the major problem is the end range of flexion beyond 110. In the end range of flexion, that cause grinding effect on the meniscus. So that's the reason we have surgeon will be most happy if you will not go beyond 110 also in the initial stages. So flexion above 90, obviously more flexion is going to injure that meniscus again. So you should not do much of flexion in the initial range in the phases of rehabilitation, at least in the first 6 weeks. They will be happy if you do up to 90, it's okay. Then another point, non-weight bearing. Again, if the meniscal tear is a bucket handle tear, then they will more suggest for non-weight bearing. And if there's only peripheral tears, radial tears, then weight bearing is not that much of an issue. So it depends entirely on the type of tear and the condition of the patient. So again, weight bearing and flexion are the right answers for this question. Very good job.